FAQs about novel coronavirus. How can I protect myself? What is a coronavirus? Coronaviruses are a large family of viruses found in both animals and humans. Some infect people and are known to cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome (MERS) and Severe Acute Respiratory Syndrome (SARS). What is a novel coronavirus? A novel coronavirus (CoV) is a new strain of coronavirus that has not been previously identified in humans. The new, or novel coronavirus, now called 2019 nCoV, had not previously detected before the outbreak was reported in Wuhan, China in December 2019. How dangerous is it? As with other respiratory illnesses, infection with 2019 nCoV can cause mild symptoms including a runny nose, sore throat, cough, and fever. It can be more severe for some persons and can lead to pneumonia or breathing difficulties. More rarely, the disease can be fatal. Older people, and people with pre-existing medical conditions such as diabetes and heart disease, appear to be more vulnerable to becoming severely ill with the virus. Can the 2019 nCoV be transmitted from person to person? Yes, the 2019 nCoV causes respiratory disease and can be transmitted from person to person, usually after close contact with an infected patient, for example, in a household workplace, or health care center. Should I wear mask to protect myself? Wearing a medical mask can help limit the spread of some respiratory disease. However, using a mask alone is not guaranteed to stop infections and should be combined with other prevention measures including hand and respiratory hygiene and avoiding close contact. How does the virus spread? The new coronavirus is a respiratory virus which spreads primarily through contact with an infected person through respiratory droplets generated when a person, for example, coughs or sneezes, or through droplets of saliva or discharge from the nose. What can I do to protect myself? 1. Wash your hands frequently. Washing your hands frequently with soap and water or use an alcohol-based hand rub if your hands are not visibly dirty. This actually eliminates the virus if it is on your hands and to avoid spreading it. 2. Practice respiratory hygiene. When coughing and sneezing, cover mouth and nose with flexed elbow or tissue. Discard tissue immediately into a closed bin and clean your hands with alcohol-based hand rub or soap and water. Covering your mouth and nose when coughing and sneezing prevent the spread of germs and viruses. If you sneeze or cough into your hands, you may contaminate objects or people that you touch. 3. Maintain social distancing. Maintain at least 1 meter (3 feet) distance between yourself and other people, particularly those who are coughing, sneezing and have a fever. Why? When someone who is infected with a respiratory disease, like 2019 nCoV, coughs or sneezes, they project small droplets containing the virus. If you are too close, you can breathe in the virus. 4. Avoid touching eyes, nose and mouth. Hands touch many surfaces which can be contaminated with the virus. If you touch your eyes, nose or mouth with your contaminated hands, you can transfer the virus from the surface to yourself. 5. If you have fever, cough and difficulty breathing, seek medical care early. Tell your health care provider if you have traveled in an area in China where 2019 nCoV has been reported, or if you have been in close contact with someone who has traveled from China and has respiratory symptoms, as this may be due to a respiratory infection or other serious condition. Respiratory symptoms with fever can have a range of causes, and depending on your personal travel history and circumstances, 2019 nCoV could be one of them. 6. If you have mild respiratory symptoms and no travel history to or within China, carefully practice basic respiratory and hand hygiene. If possible, stay home until you are fully recovered. 7. Avoid consumption of raw meat, undercooked animal products, milk or animal organs with care. This is to avoid cross-contamination with uncooked foods, as per good food safety practices. Maintaining good personal hygiene is important for both health and social reasons. That benefits your own health and impacts the lives of those around you, too. Protect yourself as well as the people around you. Let's make this world a better and safer place for everyone. Thank you for watching. Don't forget to subscribe.